Welcome back to our video series where our live panel of therapists answer the questions you've always wanted to ask a therapist. If you're watching for the first time, be sure to check out our video from last week. Again, we have with us Courtney, Heather, Tammy, Lauren, and myself. I'm Stephanie. We also have a drop-in guest, Sean, for our first question. Sean, please introduce yourself.
My name is Sean Wunderlich. I am a licensed professional counselor and a certified clinical trauma professional.
So let's get started. The question is, do therapists have therapists? And as a therapist, do you also go to therapy regularly?
I think all therapists should, prior to even considering going into the field or practicing, should experience sitting on the other side of the couch. And the other component is, or how could we, if we didn't find it valuable for ourselves, how could we sell it to other people as a valuable opportunity or experience? I actually call my therapist my patient's grand therapist. I read that in a meme somewhere and I find it hilarious, and I still use that periodically.
Yeah, I think seeing a therapist as a therapist is a kind of a different experience probably, where sometimes we bring in just our own stuff and sometimes we bring in our own stuff professionally, that it's just a unique opportunity to use another therapist to help us maybe figure out our blind spots.
Yeah, I think everyone benefits from seeing someone, talking to someone, and it's a buffer. It's somebody that you can kind of bounce ideas off of and just process more.
I've kind of learned that as a therapist, you're a holding space, a safe place for so many people, and it's such an important role, and it can also lead to some exhaustion on your own part and just needing your space to process your own life, thoughts, feelings, all of it. So that's kind of what I see as such a critical thing for therapists to see a therapist, to have that space for themselves, to also feel that they're kind of working through their own things and check in and continually have that intentional time.
For me personally, I have one that I see every week to every other week and have for about a year and a half or so. I think it's really great self-care for myself, just because sometimes I don't know how to process what's going on in our life. Sometimes I feel really overwhelmed and just need to talk with somebody, talk it through. Just because we're therapists doesn't mean that we're immune to anxiety or grief or depression or anything else that our clients are struggling with. I think it brings a really cool perspective in that I know what it's like to be a client meeting a therapist for the first time and how nerve-wracking it can be. And I also know how it feels to be a client that meets a therapist that I just don't click with, and that's okay too.
For myself, I am newer in the field, 3-some years, so I agree. I think it's really important for therapists to see their own therapists. I know I procrastinated, probably like a few other people, but right now I'm seeing my own therapist, and I'm going biweekly, and I highly encourage it. Next, we have, what's a quality that separates a good therapist from a great therapist?
I think sometimes it is more of like that feeling that they're on your team, that they support you. And I feel like that can also mean that they confront the issues that you're willing to bring in. So I think it can look like both ways, that they're like, yes, 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 but then they also ask questions about how do you feel about that? Or they'll ask different perspectives. So I think that helps too.
Maybe one of the better answers to that question is the ability to be flexible as a therapist and adapt to what the patient needs. And someone who's able to be, I think it would be hard to be all of those things, but certainly to attempt to do whatever it is that that client needs to the best of your abilities.
Yeah, I agree. It's that intuition piece to gauge and make infer if where that client's at with their readiness for being challenged and pushed, which may take longer for some clients. Sometimes they need the more gentle approach to build rapport and then be challenged so that they can actually work toward meeting some of those goals. And and pushed a bit, but I think it's definitely more of like an art that the therapist has to really be able to assess the levels of readiness from the client for that, so they don't run away.
Yeah, intuition's a big piece of that, or sensitivity, just being able to sort of read the room, read the human. I think outside of skills and training and education and all that stuff, I don't know, I have this like sort of gut reaction to good versus great, because it's kind of like if I think about parenting, and you know, when we work with new moms and they say, I want to be a great mom, and we really try to actually just say, you don't have to be great, you just have to be good enough. And so giving them permission to sort of be themselves as a parent. I think a good therapist is a great therapist. So not necessarily having to be the expert, not always having to know the right thing to do, but being human and creating more of that connection versus being the best.
Yeah, that's a good point. I think the humanness side of us, it will present at some point, right? And when we don't know something, or we say something that maybe wasn't in line with what, you know, the client was thinking. But I think it's also that humility piece of like, oh, still just a person, you know, and being able to, for them, just the client to see that you're just a, you know, you're a person, that you're just genuinely seeking, you know, what's best for them.
We're in this together.
You mess up. Yeah.
I almost feel like this was a trick question. I think that's something that, as a therapist, I don't think I can determine that for you. And that's the great part. You coming in for therapy, you get to decide on your own what makes someone good versus great for you. And I think we have our last question for today. Why is there such a stigma behind it? Why do people feel ashamed to admit they're in therapy?
Like, I feel like there are times where people will say, oh my gosh, you probably hear so much. And I'm like, well, I hear the same stressors that I'm going through, you know, or the same stressors my friends are going through. So it's not like you have to have this ridiculous story to go to therapy. You know, you just have to be willing to go and process through what's going on in your world.
I think for whatever reason, therapy and mental health, there's this negative connotation that it means weakness. And that's just stigmatized in some components of our society and culture. I think it also depends on your upbringing and your background. I know from some like cultural aspects, sharing things with someone on that type of intimate level is looked down upon. It's not something that you're supposed to do. So I think there's a lot of different factors that add into the stigma piece.
I would agree. And I think even just in this country's culture, there's a high degree of importance placed on being quote unquote happy and being normal. And, you know, we're told from a very young age, if we're crying, what do we say to kids? Like, don't cry, don't be sad, don't be scared, don't be mad. And so when we, at any age, when we experience natural negative emotions, we feel like we compare, first of all. And these days, there's a lot of comparisons made via like social media, let's say. And then we feel bad that we're struggling emotionally. We feel unwell mentally. So it's like this kind of twofold. A, we don't feel good. And B, we feel shame around not feeling good because we think everybody else is feeling good.
I was going to say, sometimes I think it's just important to know that like the goal isn't to constantly be happy, but normalizing the experience of sadness sometimes can be very validating. Like if something bad happens, of course you're going to feel sad and depressed, and working through that's more important than making it go away.
So when people come in and they say their goal is to feel happy, I say that's not really a achievable goal. Happiness is a feeling. It comes and it goes.
I think it's a lot of what Tammy kind of mentioned too, just the knowledge of like what I guess would quote warrant therapy, right? Like I've worked with some clients that I have managed such painful, challenging experiences in their life and haven't worked through those for 30 years or more and are just now, you know, coming into it and thinking that there was somebody along the way told that client that they had to just grit their teeth and dig their heels in, and that philosophy of independence that I feel our society pushes as well, which is skewed.
Thank you everyone for tuning in. Be sure to check in next week. And if you like the video, be sure to like and subscribe to our channel. We will see you next week.